Check in with Rochelle Legacy, and we're talking about the STARS helicopter.
That's right, the air ambulance that we're fortunate to have here in Manitoba. And I want to introduce you to some pretty neat people. They actually work on the helicopter. This is flight paramedic Eric McCall, and this is flight nurse Rhonda Kaluzny inside here. And first of all, Eric, why don't we just talk a little bit about what it looks like when you do get that call?
So we get the call usually through our central dispatch out in Brandon. If it's an emergency scene call, our goal is to be up in the air in about 8 minutes or so. We also get passed through for interfacility transports. That's kind of doctor decision. So we get passed through and included on the interfacility transport kind of referral over the phone.
It's a mad dash once you get that call, and then you have to get there as soon as possible.
Yeah, just our goal of 8 minutes is kind of what we shoot for, to be there as quick as we can.
And this is really an intensive care unit in the air, right?
Essentially, yeah.
All right, well, Rhonda's going to actually show us some of the cool devices that you have in here. Rhonda, you worked in intensive care as a nurse.
That's correct.
And so you've seen what it's like when there's an emergency.
That's right, yeah. And we pretty much have all of the equipment on board in the helicopter that you would find in a critical care hospital room. So some of the equipment that we have is we have 2 monitors. We have a small, very nice compact monitor. We also have a larger monitor at the back that has full defibrillation and pacer capabilities. We have an onboard ventilator for all of our patients that require ventilation during flight. We've got an iStat machine, which is a great little mini lab, and we can analyze blood samples in 2 minutes. We have a triple channel IV pump, and as you can see, most things are really compact in here, yes. So everything has its place and everything has a use.
And you have a doctor either on the flight, or you have a doctor on the phone that you can refer and ask questions to if you need help, right?
That's correct. We have a referral emergency physician that is on call with us on all of our shifts, and they have the capability of flying along with us if they're here at the base.
Why did you choose to be a part of this unit?
First of all, in my career as a critical care nurse, this was kind of the next step for me, learning a few more advanced skills and putting what I know already into practice, and going to see the air ambulance side of things is a lot of fun too. Good challenge, absolutely. Mm-hmm.
Well, Eric, you also decided to do this as a career change for yourself. Is it because you wanted to be part of in the air, or because you wanted something different?
Kind of both. It's always a little bit exciting to be able to fly around in a helicopter, of course. Definitely to bring this level of care, kind of to rural Manitoba was definitely a goal of mine, in the end of my career. So.
All right, well, that's great. Thank you so much. And now coming up in a few minutes, I'm going to introduce you to a patient who was airlifted in a STARS helicopter, and it probably saved his life. So that's coming up.
Sounds good. Thanks. We look forward to that, Rochelle.
All right, Terry's